Dermatology, sir. Let's talk about the layers. Layers. Sir, we are having layers, different layers we are having, sir. But this is corneum and basal. Between this, what is there? L-E-G-S, legs. This is how we will remember it. Sir, here C for corneum, the topmost layer, where it is called as dead keratinocyte because nucleus is absent. And if nucleus is present, the condition is called as, then if nucleus is present, this condition is called as parakeratosis. Done, sir? Then coming stratum lucidum. Lucidum is a clear cell layer present in palm and soles. Granulosal, where laminar bodies are present. Laminar bodies क्या करती है हमारा moisturization का काम करती है. If laminar bodies are absent, it will lead to the winter eczema. Now spinosum, you can see this is a thickest layer. Spinosum, you will see this is a thickest layer having a special cells called as Langerhans cell, whose function is phagocytosis. Stratum basal is the first layer to be synthesized. This is having what, sir, here? Merkel cell, sir. Merkel cell, type 1 touch receptor, Merkel cell. Also, they are having melanocyte, which will secrete a melanosome, okay, melanin, which is responsible for the color tones. Then coming to the base, that is dermis, having the sensory supply, etc. Now, these are the basic introduction. Now, we'll turn about the cells, the layers, and from where they are derived from. My dear ladies and gentlemen, here if we talk about the cells layer and from where they are divided from, the first thing we have to talk about the keratinocyte. कहता है करो या मरो, Merkel, करो, K for keratinocyte, करो या मरो, they are derived from, you have to act, करो या मरो, act, ectoderm, sir, ecto. Melano, N for no, that is your neural crest cell, sir. Neural crest cell, sir. Then लंगर खाके, L-A-N-G-E-R, लंगर खाके क्या आया? मजा. तो मजे से mesoderm, sir. मजे से क्या हो गया? Mesoderm, sir. Now, these keratinocytes, they are present in all the layer. Melano and Merkel, MM wala, they are present in the basal layer. And Langerhans cell is present in stratum spinosum. Now let's talk about this cell, keratinocyte. Hallmark क्या इसका? Keratin filament. Every layer के अंदर present होता है. Almost every layer के अंदर present होता है. Now coming to the melanocyte. Melanocytes are the other cells which are most commonly seen in the stratum basal. Here what is happening? There is a melanocyte which is secreting somme, and somme is making melanin. Now if there is an increase in melanin, the tone will be little dark, and if there is a less melanin, the tone will be more fair, and which will lead to risk of your skin cancers. Now this one melanin unit is having 36 keratinocytes, that is very equal. No matter how much melanin you have increase or decrease, every melanin unit will have a 36 keratinocytes. That means keratinocytes are not responsible for color tone. Then who is responsible? Melanin is responsible. Melanin is Merkel cell. They are type 1 touch receptors. They are having type 1 touch receptor. CK720 positive. Langerhans are having beer bag granule. How the beer bag granule? They look like a rod shape. They look like a tennis racket shape. They look like a rod shape and they look like a tennis racket shape. They look like a tennis racket shape, sir. Then they are CD207 and 1A positive, sir. The layer, sir. Basal is a first layer to be formed. Spinosum is the thickest layer, and granulosum contain what, sir? Filaggrin. Laminar bodies also they contain filaggrin also. Sir, if there is a deficiency of filaggrin, it will lead to a previous year question that is called as 𝗖𝗵𝗵𝗺 vulgaris. They will lead to what, sir? 𝗖𝗵𝗵𝗺 vulgaris. Now coming on to this winter eczema. As we already told, there are the laminar bodies in this thickest layer. If there is a decrease in laminar body, the moisturizer will go and the skin will be very dry. And this risk factor in the winter is going to be the bath with the hot water we should avoid. Plus, if there is a less sun exposure in the winters, so that will also lead to deficiency of vitamin D, and vitamin D is essential for the laminar body. So we will give a supplementation of vitamin D. Along with that, we can advise them the moisturizer. Moisturizer. Actinic keratosis, cutaneous horn. Why this is present? Because of radiation exposure is there, UV light exposure is there, pre-malignant condition for squamous cell carcinoma. Then lucidum is a clear cell layer present in palm and sole, and corneum is a topmost layer which lacks the nucleus. And yes, if nucleus is present there, that condition is called as parakeratosis. Parakeratosis. So before starting a chapter 1, we will ask some questions. Sir, question number 1. Langerhans cells are derived from mesoderm. Winter eczema is happening because of decrease in laminar bodies, sir. Next, sir. If nucleus is present in the topmost layer, what that condition is called as? Parakeratosis. Let's move on to the very next thing is, sir, blistering disorders. So if we talk about the blistering disorder, first we'll see the blister. Blister is divided into vesicle and bulla. Vesicle is smaller, that is less than 0.5 centimeter, and bulla is more than 0.5 centimeter. Bulla bada hota hai, vesicle chota hota hai. Now we talk about the pemphigus disorder. Pemphigus is an autoimmune disorder where IgG antibodies against the desmoglein, which will lead to blister formation. And this blister can erode, which will lead to crust formation. You can see right here, sir. This pemphigus is divided into two, foliaceous and vulgaris. Sir, foliaceous is like a flower. Flower is number 1 item, that is why desmoglein 1. Vulgaris is like a vulgar, that is desmoglein 3. Then coming, flower is present in grand mass orchid, so granulosum. Vulgaris बातें कहाँ होती है? कांटे की तरह चुपती है, स्पाइनोजम, स्टार्टम स्पाइनोजम. Then foliaceous flower को ऊपर से छूना है, that is why superficial bulla. And pemphigus vulgaris, there is going to be the deep bulla. Now what common signs you are going to see, sir? Sir, common sign, one is tangential force, which is coming like this. One is perpendicular force. If tangential force is coming, there is going to be the 𝗏𝗏𝗃 sign. And if perpendicular force is coming, there is going to be the bulla spread sign. There is going to be what, sir? Bulla spread sign. Plus you are going to see the row of tom appearance, which you can very well see here. Direct immunofluorescence study, you will see the fish net like pattern where IgG plus C3 is deposited. C3 is deposited, my dear friends. Treatment with steroids, cyclophosphamide, and rituximab. So what crux we have studied? Pemphigus, foliaceous and vulgaris. There is a IgG antibody against the desmoglein, which will lead to the blister formation. And they are having tendency to get ruptured. Then 𝗏𝗏𝗃 sign, then Bullard spread sign, then row of tom appearance is there, then fish net appearance is there. These are some important things we have to study in that. Now bullous pemphigoid. Now what is happening, sir? IgG against BPAG2 gene. Now IgG against BPAG, tense subepidermal bulla is seen, sir. Blisters are present, but 𝗏𝗏𝗃 sign and row of time appearance is absent. Treatment is steroid. But if a linear IgA disease, now antibody IgA is against BPAG2. Like bullous pemphigoid, there was IgG against BPAG2. Here there is a IgA against BPAG2 gene. Here you are going to see what string of pearl appearance. You can very well see string of pearl or bead appearance like this. String of pearl or bead appearance like this, sir. And on direct immunofluorescence studies, you are going to see the linear pattern, sir. This is it. Now dermatitis herpetiformis. What is happening? This is associated with the celiac disease, where there is a crypt hyperplasia. You can very well see these are the crypt. But in the celiac disease, there is a hyperplasia of the crypt. That is why there is a no gap left, sir. No gap. Drug of choice is Dapsone. Plus you have to avoid a gluten-free diet. Plus you have to take a gluten-free diet, and you have to avoid barley, rye, oat, wheat. Here is, you can see the crypt hyperplasia. Crypt hyperplasia has happened, sir. Barley, rye, oat, wheat. Now coming to the next one. And next one is going to be what, sir? Your Darier's disease and Halle-Halle disease. Both are having calcium ATPase channel defect. In both of them, what will happen? Calcium ATPase channel defect is going to happen. Sir, what involvement is there? Seborrheic area, these are involving the skin fold. What sign you are going to see? Sandpaper-like appearance. In the Darier's disease, what you are going to see? Sandpaper-like appearance. And in the Halle-Halle disease, you are going to see brick wall-like appearance. For the Halle-Darier disease, where brick wall-like appearance, treatment is oral retinoid. And where Halle-Halle disease, there is a brick wall-like appearance. Here treatment is 𝗵𝗵𝗵. Monoclonal antibodies you have to give, sir. Erythema multiforme. Viral infection and drugs can cause that. What lesion you are going to see? You can see right here, sir. Target sign, iris sign and bull's eye. Target sign, iris lesion and bull's eye. And this is associated with Lyme disease, where there is going to be the calf muscle congestion, and in eyes there is going to be the suffocation and coming from the rat urine. Most common cause here in the epidermic lesion, you will see 10 and Stevens-Johnson's because of the drugs. Now here the important catch is your body surface area involvement. In the toxic epidermal necrolysis, there is a body surface area involving more than 30%, and the Stevens-Johnson syndrome, the body surface area involvement is less than. In both of them, you will see the pseudo-𝗖𝗵𝗵𝗃 sign. The 𝗖𝗵𝗃 sign, pemphigus foliaceus and vulgaris, and pseudo-𝗖𝗵𝗃 sign is seen in the 10 and Stevens-Johnson syndrome. 10 and Stevens-Johnson syndrome. Now, erythema nodosum multiforme we have seen. Now it's time to study erythema nodosum and marginatum also. Nodosum, there is an inflammation of a subcutaneous fat. So this is a painful condition, tender, and causes sulfa drug and sarcoidosis. Erythema marginatum, reactive inflammatory condition associated with acute rheumatic fever. If a patient is having a history of acute rheumatic fever, there is a chances you are going to see the serpentine lesion like this. Serpentine-like lesion like this. Done. Then next chapter is infections. Before that, let me ask you some question. Sir, IgG against desmoglein is seen with pemphigus. Sir, IgA against BPAG2 is seen in linear IgA disease. Drug of choice for linear IgA diseases? Dapsone. It is going to be Dapsone. Sir, which special things you have to avoid in glutein hypersensitivity? Dermatitis herpetiformis. What diet you are going to avoid? And multiple time asked question in the exam, sir. That it is barley, rye, oat and wheat. Sir, pseudo-𝗖𝗵𝗃 sign seen in two conditions. What are those two conditions, sir? Sir, Stevens-Johnson syndrome and 10. Toxic epidermal necrolysis. Now going to the next one, infection. We have studied this erythema. Yesterday only we studied the microbiology caused by Corynebacterium minutusii. And what you are going to see, the velvety appearance, and on wood slab you are going to see the coral red color, sir. Coral. Non-bullous impetigo caused by Streptococcus pyogenes. Streptococcus pyogenes is gram positive or gram negative? It is gram positive. Cocci. Catalase negative. Cocci. Yes. Gram positive. Golden yellow honey color crusting will be there. The child will be giving history of a honey eating. Cellulitis. Sir, cellulitis is caused by both Streptococcus pyogenes and aureus, sir. Pyogenes and aureus, sir. Sir, aureus will lead to two type of endocarditis. I told you microbiology is an overlap with ER dermatology, sir. Sir, here cellulitis, what is happening? Diffuse swelling. Margins, you cannot tell the margins, sir. There will be increase in the inflammation. The cardinal signs like Ruber, tuber, dollar, Keller, functional ratio will be seen right here, sir. Cellulitis. Cellulitis, sir. Sir, what two endocarditis you are going to see, sir? IV drug abuser में क्या देखने मिला था? Right sided valve endocarditis. And other type of endocarditis was native valve endocarditis. Native valve endocarditis. चलिए. Moving on to this, folliculitis, frunculosis and carbuncle. Folliculitis is a superficial infection. Frunculosis is a deep infection of a hair bulb, and if multiple hairs are involved, that is called as carbuncle. Cause can be bacterial, virus, fungal or parasite. Erythema. Question asked in the exam. Sir, erythema is what happening? There is a plastic type of desquamatation is happening on the skin. Puffy swelling is happening on the skin. So who is causing that? Streptococcus pyogenes, affecting the superficial area of the skin. Superficial layer of the skin. Treatment is penicillin per oral or IM penicillin you have to give. Puffy swelling on the face. Red, puffy, plastic type swelling is erythema. Okay? Don't ever confuse it with the SLE. SLE is not a puffy swelling. SLE is not a puffy swelling, sir. Then fungal infection like pityriasis versicolor yesterday. Some Malassezia globosa, better answer than furfur. If we put this on 10% KOH mount, what appearance you are going to see? Spaghetti and meatball appearance. Spaghetti and meatball appearance. Sir, on Wood's lamp, what we are going to see? Apple yellow color fluorescence. We are going to see apple yellow color. Very, very good. Topical treatment, ketoconazole. Systemic is selenium sulfite. Now, let's talk about the next condition called as candidiasis. Candidiasis, sir, here is vaginal and oral. You will see whitish discharge coming from the vagina, and oral thrush is going to be caused by Candida albicans. On Saburat dextrose agar, you are going to see 𝗵𝗵 colonis. 𝗵𝗵 colonis plus one phenomena you are going to see. This is Raynaud Brodys phenomena. Raynaud's Brodys phenomena you are going to see, sir. Yes, sir. Drug of choice is fluconazole. Pedra, sir. Black pedra is by Pedra horti, white is by Trichosporon bijli. Dermatophytosis, a very important topic for your exam, ladies and gentlemen. Sir, here we are having three: tricho, micro and epidermophyton. My difference? Here the skin, hair and nail involvement we have to check. In the tricho, every part is involved, skin, hair and nail. And also skin is involved in all. Tricho में तीनों involved है और skin सब में involved है. Micropore से hair निकलते हैं, that is why along with the skin hairs are involved. What is left? Nail. So skin and nails are involved in epidermophyton. Now this trichophyton is looking like a cylinder shape. Trichophytons are cylinder shape. Microsporon is having SS for spindle shape. You can see spindle shape. And epidermophyton, you have to remember multiple shapes are there. Sir, remember like this: epic people go to club, sitting in a boat, eating pear. So there will be a club shape, boat shape, pear shape. Club shape, boat shape and pear shape. Club shape, boat shape and pear shape. So trichophyton, microsporon and epidermophyton is clear to all of you. Now tinea capitis. टीना भाभी कहाँ चढ़ी? सर पे. दो बच्चे हुए इसके. एक का नाम था किरण, जिसके अंदर बोगी स्वेलिंग हुई, और एक का नाम हुआ फेवस, जिसके अंदर पपड़ी बनी. तो ये कीरियन कैसी थी? बोगी स्वेलिंग. और ये फेवस कैसा था? पपड़ी जैसी स्वेलिंग. कैसी थी? पपड़ी जैसी स्वेलिंग. अब टीना भाभी को सर से नीचे उतारना कैसे? घिस के. तो याद रखना, ड्रग ऑफ चॉइस फॉर टीनिया कैपिटिस इज गोइंग टू बी द ग्रिसियोफ्लुविन. इट इज गोइंग टू बी व्हाट, सर? ग्रिसियोफ्लुविन. Now other teneas are like tinea manus, pedis, angizum and cruris. Tinea manus, pedis, angizum and cruris. Manus is seen in hand, pedis is in feet, angizum is in nail, cruris is. And drug of choice is terbinafine is better answer than itraconazole. It's better answer than the itraconazole. Porothorax canker is causing sporotrichosis, rose gardener's disease, linear nodule along with the draining lymphatic. What is the treatment? Treatment is itraconazole. Chromoblastomycosis, copper penny bodies, sclerotic bodies. Drug of choice is again itraconazole. Mycobacterial infection, two type skin infection you have to remember like here, sir. One is lupus vulgaris, another is scleroderma. Sir, lupus vulgaris, you are going to see the plaque, central scaling is going to see with the inflammation on the side. And on diascopy, you are going to see the apple jelly nodule. On the diascopy, you are going to see what, sir? Apple jelly nodule. Then scleroderma, most commonly seen in the children with the draining sinus. Draining sinus, you are going to see draining sinus. Leprosy. Now, different type of leprosis you have to talk about. First of all, Ridley-Jopler's classification, if we talk about TT, BT, BL, BB, LL. Out of this, very important is what, sir, to know that good prognosis is of TT and poor prognosis is of LL. First thing. Second is most common type of India is BT. So here we talk about the BT. BT, you are having a satellite type of lesion. You are having a satellite type of lesion, sir. Satellite lesion. And now this kind of image you are going to see in the LL type having worse prognosis of the leprosy. Then again the leprosy virulence factor is PGL1 and LAM. PGL1 and LAM. Most common cranial nerve involved is facial nerve. Overall most common nerve is ulnar nerve. Most common nerve for biopsy is radial cutaneous nerve, and temperature loss, earlier cold, more common than the warm, my dear friend. Cold more common than the warm, my dear friends. Now coming to the multibacillary versus paucibacillary. Multibacillary, you will see the lesions are less than 6, and multibacillary lesions are equal to or more than 6 lesions are there. For multibacillary, treatment goes for 12 months and paucibacillary treatment goes for 6 months. And what treatment we are giving in the leprosy patient is RCD, that is rifampicin, clofazimine and dapsone. How much it is given? An adult dose has been asked in the exam multiple time, my dear friends. Yes, number one is rifampicin, 600 mg once a month we will give, sir. Clofazimine 300 mg का एक tablet once a month followed by 50 mg daily, and dapsone is दे दनादन रोज देना है 100 mg daily, 100 mg daily, sir. The rifampicin is 600 mg once a month. Clofazimine is 300 mg का एक tablet followed by 50 mg daily, and dapsone is 100 mg daily. Dapsone is what, sir? Your 100 mg daily. Now lepra reaction, type 1 and type 2 lepra reaction, if we have to talk about, sir. Type 1 lepra reaction is associated with type 4 and type 2 is associated with type 3. Total sum would be 5. 4 plus 1, 2 plus 3. Now this is seen in, type 1 is seen in BB, BT देती है बिल भरवा के, तो BB, BT, BL, and type 2 is associated with LL type of leprosy. Sir, clinical feature in the type 1 is pre-existing tender lesion, and in the type 2 is new nodular lesions. Systemic involvement in case of a type 1 is absent, and in the new nodular lesion, which is LL type, yes, systemic involvement is present because LL type is having the worst prognosis. Treatment is first NSAIDs because it is a tender lesion, that is why first we'll give NSAID, but drug of choice in both of them would be steroid. So this is pre-existing tender lesion and these are the new nodular lesion in type 1 and type 2 lepra reaction. Chalo, some questions and then we'll move forward. Sir, India mein most common type of leprosy is going to be BT type. Which lesions you are going to see in the BT type? You are going to see the lesion called as satellite type of lesion. Sir, coral red appearance on Wood's lamp examination is because of erythema. Sir, in the 10% QH mouse, spaghetti meatball appearance is a feature of pityriasis. चलो आगे बढ़ते हैं. Let's talk about the sexually transmitted infections. You will see right here, sir, easily. Sir, first of all, syphilis. It is caused by Treponema pallidum. There are 3 stages of syphilis. Can anyone tell me the 3 stages of syphilis? First stage is going to be the painless chancre. Painless chancre. Second, there is going to be the raindrop pigmentation. Third is going to be the gamma formation. And here you will see the syphilis lesion right here, sir. If you will focus here, sir. This is smiling, happy lesion. हंसता हुआ नूरानी चेहरा. कहता है, what is the drug of choice right here, sir? Drug of choice is going to be the benzathine penicillin. The drug of choice is going to be, sir, benzathine penicillin. Except neurosyphilis, what will be? Aqueous crystalline penicillin will give, sir. अब आया LGV, lymphogranuloma venerum. Now what is happening right here? Groove sign, and this is caused by chlamydia trachomatis. और यहाँ रहता है LGV stands for लगे रहो. तो कौन लगे रहो? डॉक्टर साहब. तो ड्रग ऑफ चॉइस फॉर डॉक्टर साहब इज डॉक्सीसाइक्लिन. LGV drug of choice is doxycycline, and here you are going to see the groove sign, sir. Here you are going to see what, sir? Groove sign. Now chancroid. Chancroid is a painful ulcer. You can very well see how painful it is and how badly this ulcer is crying. क्या कह रहा है? तो कोई रो रहा हो तो उसको चुप कराना है. कैसे चुप कराओगे? अजी चुप हो जाओ. अजी चुप हो जाओ मतलब अजिथ्रोमाइसिन. अजी चुप हो जाओ मतलब अजिथ्रोमाइसिन. And this is caused by the 𝗏𝗶𝗵𝗃. This is caused by the 𝗏𝗶𝗃, sir. Done. Now donovenosis is caused by 𝗏𝗃 granulomatous. What is having? A beefy red ulcers which bleeds on touch. So donovenosis caused by 𝗏𝗃 granulomatous. Again here the same problem is there. अब आंसू कैसे आ रहे हैं? खून के आंसू आ रहे हैं. So remember, तो खून के आंसू वाले को भी बोलना है अजी चुप हो जाओ. The drug of choice is going to be azithromycin. ठीक है? azithromycin. Congenital syphilis, गांधी जी के 3 बंदर क्या क्या? Interstitial keratitis. There will be a peg shaped teeth and there will be a sensory neural hearing loss. Sir, gonorrhea. Neisseria gonorrhea, purple color, cocci colonis, gram negative, sir, drug of choices, ceftriaxone, purulent white discharge is coming right here, sir. Then coming, sir, Papulosquamous disorder. Before that, let me ask you some question. Sir, painful ulcer seen in, question number 1, painful ulcer is seen in chancroid caused by, painful ulcer is seen in chancroid caused by 𝗏𝗌. Painless ulcer is seen in, that is seen in syphilis caused by Treponema pallidum. Sir, groove sign is seen in LGV. Sir, beefy red ulcers which bleed on touch is seen in D से है something, D से donovenosis caused by Klebsiella granulomatosis. Very, very good. Sir, purulent white discharge is seen in, sir, gonorrhea. Very good, very good, very good. Let's move on to the next, and that is Papulosquamous disorder. Number 1 Papulosquamous disorder is going to be the psoriasis. And most common psoriasis, psoriasis vulgaris, which is a plaque psoriasis. Here is a silvery white scaling you are going to see, and after removing this, there is going to be the pinpoint hemorrhage. This is called as Auspitz sign, and also the test is called as Grattage test. Now, type of psoriasis, plaque psoriasis, which is the most common type, there is the psoriasis vulgaris. Treatment is steroids. Guttate psoriasis, the history will be of a upper respiratory tract infection and nummular lesion you are going to see on the trunk, my dear friends. Treatment is macrolide. Only psoriasis where antibiotic is given is a guttate psoriasis. Is what, sir, your guttate psoriasis. Then coming to the pustular psoriasis. The pustules are there and there is a history of sudden withdrawal of steroid. And here treatment is acetate. Inverse psoriasis, again treatment is steroid. These are different type of psoriasis and treatment we have mentioned about. Treatment summary: if less than 10% of the body surface area is involved, topical steroid, retinoic acid, coal tar we give. More than 10% may we give phototherapy. If no response to phototherapy, the last dose is what's called methotrexate. Lichen planus, an autoimmune condition. Lacy lesion in the buccal mucosa, nail में nail pterygium are purple color pruritic lesions you are going to see. Koebner phenomena you are going to see, sir. And Koebner phenomena is also seen in vitiligo, psoriasis and lichen planus, VPL. Vitiligo, psoriasis and lichen planus, sir. Now coming to the pityriasis rosacea, herald patch which is arranged in such pattern. This is called as Christmas tree pattern. Usually a self-limiting condition. This condition is a self-limiting condition, my dear friends, and if it is not getting relief, we will use a low dose steroid. Now lichen nitidis, you are going to have a typical feature for this. You have to remember, first of all, nodular lesion. If we prepare a slide, a cut slide into this, you will see a clutch in ball appearance. Chalo. Let's talk about the pigmentary disorders right now, sir. Pigmentary. Number 1 is melasma. Sir, increase in melanin in the after pregnancy is called as melasma. What about during pregnancy? It is called as, during pregnancy, जो pregnancy mask आता है, this mask is called as, can anyone guess the answer? This pregnancy mask is called as chloasma. This is called as chloasma. A Mongolian spot, just a normal spot, bluish, it can go, can stay, doesn't matter. If it is involving your mukhota, it is called as nevus of ota. If it is involving your body, this is called as nevus of ito. And if along with the ito, there are the hairs present, then this is called as Bacchus nevus. Now coming to the depigmentation because of the toxins secreted by the different products. Now let's see what are the toxin and what is the source. So टॉक्सिन सोर्स हिज रबर से क्या निकलता है? क्वीनॉन. हाइड्रोक्विनॉन इज लाइक अ क्वीन क्या पहनती है? रबर की चप्पल. पति, प्यारा ब्यूटानॉल. पति के लिए क्या पहनते हो? बिंदी. तो याद रखना, बिंदी से निकलता है प्यारा ब्यूटी फिनॉल. अब प्यारा ब्यूटी कैटिकॉल. कैट के क्या होते हैं? हेयर, बाल. तो हेयर डाई से निकलता है कैटिकॉल और फिनॉल निकलता है बिंदी से. और हमारी क्विनॉन, जो हमारा क्विनॉन है रबड़ की चप्पल, दैट इज फ्रॉम द रबड़, सो दीज आर द डिफरेंट important toxins along with their sources. Chikungunya, chick sign, there is a hyperpigmentation is there. Can you tell me which mosquito is causing the chikungunya? Aedes, web of killer, Aedes mosquito. Aedes mosquito, right? Acanthosis nigricans associated with metabolic X syndrome. Metabolic X syndrome is associated with PCOS, diabetes mellitus, obesity, hyperpigmentation of the skin will be there, looking like a velvet cake. Now Peutz-Jeghers syndrome. My dear, Peutz-Jeghers syndrome, there is going to be the perioral lentigen and also STK11 gene is involved, and there will be a hamartomas polyp in the GIT. STK11 gene and hamartomas polyp. Very good. Fixed drug eruption, hyperpigmented patch because of the drug reaction. Stop that drug and go some low dose steroid, you are going to fix it. Piebaldism, neural crest cells are dysfunctioning, where you will see a white forelock sign. What is white forelock sign? A patch of skin and hair are depigmented. Vitiligo, we are having segmental vitiligo and other type of vitiligo in which there will be absence of some part of melanin. Freckles increase in melanin and complete absence in melanin leads to albinism. Now last chapter what we are going to stop is skin appendages. Skin appendages, sir, there is going to be the hair, nail and gland we have to talk about. Number one thing is hair cycle. My dear friends, hair cycle if we talk about anagen, catagen and telogen. Sir, anagen is a growth phase, catagen is an involution phase and telogen is a resting phase. So growth, involution and resting phase. So growth phase is for 3 years. फिर सीधा नीचे आ जाना है 3 weeks and then 3 months. 3 year, 3 week, 3 month. 3 year, 3 week, 3 month. Anagen, catagen, telogen. Anagen, catagen, telogen. ठीक है? चलो. Now androgenic alopecia is because of the faulty testosterone. Now your normal testosterone is converted into 5-dihydrotestosterone with the help of 5-alpha reductase. Because of that, in the male, the pattern coming like this is called as Hamilton pattern, and female 2 patterns are there. One is Ludwig, जो मांग बीच से, and second is, oh my God, side से, that is your Olsen. Olsen is from side and Ludwig is from center. So these are the pattern by which female lost their hair. Topical treatment is minoxidil and systemic is finasteride. Systemic is finasteride. Then coming to the alopecia areata. Alopecia areata, there is going to be the patchy hair loss. Patchy hair loss. This is an autoimmune condition. And also the hair you are going to see right here, sir. Exclamatory mark hair is going to see. Nail की बात करेंगे sir. Nail psoriasis. चलिए, sir. Nail psoriasis, most characteristic and most common finding. So, sir, most characteristic finding is going to be the oil drop sign, which is also called as salmon patch. And most characteristic is going to be the pitting. Terry nails, congestive heart failure and hepatic failure ka feature. Half and half nail, renal failure, paronychia infection of the nail bed and thickening of the nail plate is called as subungual hyperkeratosis. Hyperkeratosis. Now sweat gland, 2 type, eccrine and apocrine, sir. Eccrine is opening directly and apocrine is opening along with the hair follicle. When the duct is opening directly, either there is a hyperhidrosis or anhidrosis. या बहुत ज़्यादा होगा या बहुत कम होगा. तो hyperhidrosis is excessive, anhidrosis is no. And this is associated in the children. If it is blocked, then there is going to be a disease. Again, a previous year topic, malaria, sir. And apocrine, sir, Fox40 disease, itchy papules are seen like. Acne vulgare is very important, sir. Most characteristic feature is comedone. Now this comedone is of 2 type. Open comedone where the dust will settle and because of the dust it will become black. And closed comedones are white in color. Now what are the different stages we are having? Grade 1 is having the comedone. The characteristic feature, grade 1 is having the comedone. Grade 2 is having the pustules. Grade 2 is having the pustules. Then grade 3 is having the papules. Sorry, grade 2 is having papule mostly and grade 3 is having pustule. So comedones, papule, pustule and C for char. Char से क्या है? Nodules plus cyst. nodules plus cyst, nodule plus cyst, nodule plus cyst. So comedones, papules, pustules and nodules and cyst, nodules and cyst. Treatment grade 1, where you will see the grade 1, where you will see the comedone treatment is topical retinoid. Grade 2, where you will see the papule, the treatment is topical antibiotics. Where you will see the pustule, grade 3, the treatment is oral antibiotic. And where you will see cyst and nodule, the treatment is going to be the isoterritinoid. Previous year topic of the exam. Grade के हिसाब से treatment पूछा जाता है. Which treatment which we are giving, sir? Now rosacea. What is rosacea? Rosacea is a problem in which a person is feeling flushing after going to the dry areas, hot liquids, hot food. And this is something which is self-limiting condition, rosacea. Miscellaneous topic. Number 1 is capillary hemangioma. It is present by birth, sir. And this hemangiomas can be present anywhere. Here it is benign tumor. It will be removed with the help of laser later on, sir. Collodion baby. What is happening in the collodion baby, sir? Congenital ichthyosis, where baby born with the plastic-like skin because of the squamatization disorder. Here will keep baby in a warm environment, warm moist environment. Later on the squamatization will be corrected and the baby will be fine. But Harlequin baby, Harlequin ichthyosis is having 100% mortality rate and genetic disorder is ABCA12, ABCA12. Now staphylococcal scald system syndrome has been asked recently, my dear friends. Etiology is going to be Staphylococcus aureus. Because of this, there is going to be the plastic-like squamatation and desquamatation happening. Most common age is 3 to 7 days. Blister conjunctivitis you are going to have. Treatment is again because bacterial infection, antibiotics you are going to give. Now the last topic is neurofibromatous type 1 and neurofibromatous type 2. Type 1 is autosomal dominant associated with chromosome number 17. What features you are going to see? Sir, leash nodule, number 1. Scoliosis, sir. There will be optic glioma. Third, neurofibromas. Yes, sir, there will be a 𝗵𝗵𝗿𝗺 spot. 𝗵𝗵𝗿𝗺 spot and Schimm's short stature is going to be there. Leash nodule, 𝗵𝗵𝗿𝗺 spot, optic glioma. Then there is going to be scoliosis, short limb. These all are the features of your neurofibroma type 1, neurofibromatous disease type 1, which is on chromosome number 17. Now coming to the NF2, neurofibromatous type 2, this is chromosome number 22 associated with schwannoma, which is the 8th nerve tumor, where we have saw the ice cream in cone appearance. Here you are having a Verrucchi bodies. These Verrucchi bodies is arranged in a palisading pattern, and here is having a 2 areas. If there is a lot of density of Verrucchi bodies, this is called as Antony A area. If there is a less density of a Verrucchi body, this is called as Antony B area. Now this again completes our 2 subjects, my dear friends. One is radiology and another is your dermatology. Few questions I will ask and then we'll start from the pediatrics. Question number 1, sir. Sir, neurofibromatous type 1. Can you tell me any 3 features, important 3 features of neurofibromatous type 1, sir? 𝗵𝗵𝗿𝗺 spot, very good. Scoliosis, optic glioma, very, very good. Sir, half and half nails are features of chronic renal failure. Sir, malaria, hyperhidrosis, anhidrosis is apocrine or eccrine sweat gland disorder? Sir, eccrine sweat gland disorder. Eccrine. Nail pterygium, most common characteristic finding is going to be lichen palus. Sir, salmon patch and oil drop sign is a feature of nail psoriasis.